Okay, it looks like it's top of the hour. Thank you everyone for joining us today on this St. Patrick's Day. Happy St. Patrick's Day to everyone, and a quick happy birthday to my husband and my mom who are celebrating today. Just a couple quick things before we get started. The question and answer session will be at the end. We'll leave a little bit of time for that. So please submit your questions via the chat function anytime throughout the webinar. And certificates will be available on Fridays by downloading those off your account. Kelly, if you'd like to get started, go right ahead.
Yes, thank you so much for inviting me to be here today, and happy St. Patrick's Day. I wish I had had the forethought to pack a green shirt. I'm actually on vacation visiting my son at college in Nashville, Tennessee. Lots of bad weather where we are, hoping y'all are having better weather where you are so you can celebrate St. Patrick's Day. It's actually my grandfather's birthday, so lots of birthday celebrations on this fun day. But I am just delighted to be here today for us to just, pause and share this time where we can think collectively about the devastating impact of COVID, not only on our nation, but on our NICU parents. And what has the restriction on visitation policies collectively been for our NICU families, and what impact has that had? And what do we need to be thinking about as we prepare for the future? We should certainly hope there is never another COVID, but I think it's really important that we pause and think about this and look at it and research it and have these really important conversations of what can we learn from the past year so that we can do better for NICU families in the future and make sure that they have all the support that they need. So our objectives today are understand the potential long-term impact of hospital visitation restrictions for NICU families and identify strategies to provide psychosocial support for NICU families during and after hospital discharge. So with that, I'm going to pull up my slides here. I do not have any disclosures at this time, so I'm just going to jump right in. So as we know, today is March 17th. This time last year, the reality of COVID-19 was just beginning to take hold in the United States. Shelter-in-place orders were, being mandated to stop the spread of the deadly virus, and hospitals across the country and around the globe began to impose new policies regarding patient visitation. And strategies for neonatal intensive care units began to be put in place to mitigate the spread of the virus, but they were not standardized across the country. Every unit, region, county had different protocols, and despite decades of research supporting the importance of family-centered care to ensure best outcomes for babies and families, most NICUs were forced to make the very difficult decisions to limit parent visitation hours, some even completely restricting all parent visitation in order to ensure the health and safety of the healthcare team. But what are the consequences of these restrictions that were imposed? Early in the pandemic, I was honored to be asked to lend a parent's voice to an article by neonatologists, pediatricians, and psychiatrists from medical schools at Duke, Emory, and Stanford that were warned of the host of potential downstream consequences of these restrictions in the NICU. And they predicted decreased parent presence at the bedside, decreased engagement in clinical care, and decreased readiness for home. The paper stated the urgent imperative to understand how COVID-19 impacts infant, parent, and family outcomes. What can we learn from the stories of parents impacted by visitation restrictions? And how can we ensure they and their babies and families get the support they need to mitigate long-term mental health challenges for parents and ensure their babies have every opportunity to thrive in the NICU and beyond discharge. As a NICU graduate mom twice over, I honestly just cannot even imagine navigating a NICU stay during a global pandemic. On its own, a NICU stay is emotionally, physically, financially, and psychologically draining, and often the most terrifying and isolating experience of a parent's life. Just a few hours after the delivery of my first child by emergency C-section, a nurse pushed my wheelchair down a long hall to the NICU. The mixture of pain medication and the heat from the warming lamp above my son's bed made me feel faint as I struggled to stand. I desperately tried to see my baby's face hidden behind the tape, affixing the respirator tube to his mouth. To me, he looked more like an alien than a baby. A stoic neonatologist went with me and my husband to explain the challenges our son, who was born at 24 weeks, weighing just a pound and a half, would have in the first hours, days, and weeks. Should he live, the neonatologist explained that Jackson may have lifelong disabilities, including hearing and vision loss, cerebral palsy, and developmental delays. I was overcome with emotion. I felt sick and disoriented. I was ashamed, full of self-doubt and fear and anxiety and uncertainty. I truly did not think I had what it took to be a mom to a baby with special needs. I felt like I had failed him. I had failed my husband. I wanted to go back to my room. I wanted to run and hide and deny. I had truly never felt so vulnerable, broken, and alone. I could not have known it then, but that vulnerability would give birth to Hand to Hold, a national nonprofit that now provides support to tens of thousands of NICU and bereaved parents each year. I have spent the better part of the past 2 decades working to raise awareness of the devastating impact of traumatic birth and the long-term psychological maladies that plague NICU parents, including postpartum depression, anxiety disorders, and PTSD. It is vital that NICU parents have access to support because these perinatal mood disorders have a direct impact on a parent's ability to bond with and care for their medically fragile child, and in turn can have a devastating impact on the baby's physical, cognitive, behavioral, and emotional development. While COVID restriction policies were put in place to protect healthcare workers, medical fragile babies, and their families, I worry that they also threaten to undo the tremendous strides NICUs across our country have made to improve family-centered care. That's why it's so imperative that we examine the implications of these policies so we can balance the tension between mitigating the spread of the virus and the long-term mental health implications of denying parents access to their medically fragile babies. As we worried about scoring a 12-pack of toilet paper and how to help our children manage online learning, NICU parents were crippled with anxiety because they could only visit their child 1 hour a day, or in some cases, not at all. They worried that they would contract the virus and potentially spread it to their baby, their care team, and to other babies and families in the NICU. Most were forced to navigate their NICU journey alone because of travel restrictions, which kept their family and their friends from coming to their aid. And like many of us on the call today, NICU parents also lost family and friends to the virus while their baby fought for life in the NICU. Many lost their jobs or feared for their financial security. Some faced housing insecurity, food insecurity, and the inability to obtain social support. And while all of them desperately wanted their baby to come home, they agonized about how they would possibly care for their medically fragile child and keep them healthy after discharge. Thana Jakes delivered her son, Xavier, at 23 weeks gestation on February the 11th of 2020 in New York City. He faced many challenges in his first weeks of life, and his long-term prognosis was impossible to predict. After nearly a month spending every possible moment at his bedside, Thana and her husband David were told that because of COVID-19, the hospital was implementing a new visitation policy of 1 hour a day per parent for the NICU. Thana said she had a really hard time understanding the reasoning behind this decision. She did not understand how not only allowing one parent in the unit each day would limit the spread of the virus, especially given she and her husband were living together. They were sharing a car and a bed. She questioned how limiting visitation to 1 hour a day would prevent exposure. She, like most NICU parents impacted by these visitation restrictions, said the hospitals did a poor job communicating the changes, which caused adversarial relationships between parents and providers. I heard this story over and over throughout the past year. Thana also shared with me how difficult it was to make the 1 hour drive to the hospital alone each day. Excuse me, I need just a drink of water. She shared with me that previously she and her husband used that time to process all that their baby was going through and discuss Xavier's care. She said it was harder to process the information the doctors and nurses would give her during these short visits, and how challenging it was to then relay that information back to her husband. She said she just wanted to spend as much time as she could at her son's bedside talking to him and letting him know he was loved. On April the 8th, Xavier coded and both parents rushed to the hospital and were both allowed to be at his bedside. Luckily, Xavier recovered, and the neonatologist said it was just Xavier's way of saying he needed both parents with him at the bedside. Xavier spent 7 months in the NICU, and fortunately, instead of being released to go home, he had to spend the next 3 months in rehabilitation center so that Thana could learn to care for her son, who was trach and G-tube dependent. Had Thana been allowed to be with Xavier in the NICU, she would have been taught to care for her son's medical needs. While some elements of discharge teaching may be amenable to virtual instruction, others require hands-on manipulation of equipment and medication. Visitor restrictions make it challenging for all infant caregivers to receive in-person instruction, which may influence the length of stay, parent confidence, and parent self-efficiency. And while increased use of telehealth services is both inpatient and outpatient settings has the potential to benefit many infants and families, especially those burdened by challenges with transportation, childcare, and chronic medical needs, 25% of the population has limited digital literacy or access to appropriate internet bandwidth to allow participation in a video-enabled telemedicine visit. Thana said the entire 10-month ordeal was like an out-of-body experience. She was terrified of contracting the virus and missing out on her 1 hour a day visit with her son, or worse yet, spreading the virus to him or his care team. She said it caused a huge strain on her marriage, and she found it difficult to concentrate at work, but knew she had to save her maternity leave so she could care for her baby once he was discharged. But even though she was limited to just 1 hour a day at her son's bedside during his NICU stay, Thana knew her baby. As is common in the NICU, parents recognize their baby's normal behaviors and mannerisms, so much so that during that very short visit one day, Thana noticed her son's feeding tube was displaced and causing him discomfort. She was terrified when she left that it might happen again and no one would notice. While there is no research to indicate that COVID impacted the medical care of babies in the NICU, a recent study conducted at Lucile Packard Children's Hospital, which is still under peer review, found that not only did visitation restrictions significantly reduce family-delivered developmental care, but also staff-delivered developmental activities. While many NICUs now offer bedside cameras so parents can monitor their baby and even interact with the care team from afar, Thana's unit did not have that luxury. The constant strain and worry took its toll on Thana, and she knew she needed help to process all she was going through. But just as her hospital did not offer video cameras, it also offered no support services. Thana turned to the internet and luckily found the support she so desperately needed through Hand to Hold. Thana is not alone. More than 500,000 parents experience a NICU stay each year in the United States. This means that hundreds of thousands of NICU parents across the country face similar challenges to Thana and her husband and baby. And while we know that approximately 1 in 4 NICU parents reported experienced symptoms of post-traumatic stress prior to COVID, doctors, researchers, mental health professionals, and parent advocates are all speculating that the next pandemic we will face as a nation is one of mental health disorders. And unfortunately, this mental health pandemic may disproportionately impact NICU families. And the risks are even higher for NICU mothers of color who have been disproportionately impacted by COVID-19, have a higher risk for perinatal mood disorders, and are often reluctant to seek help due to systematic racism in our healthcare system and/or cultural beliefs about mental health. And even when these mothers seek support, it is often non-existent, or there are so many barriers to accessing support, like language barriers, transportation barriers, cost, non-flexible employment, and lack of childcare. In even the most routine times, the NICU is a stress and anxiety-provoking place for parents. For parents of children born extremely preterm, the NICU is the location of what is likely one of the most traumatic experiences of their family. In their new book, The Treatment of Psychological Distress in Parents of Premature Infants, PTSD in the NICU, Dr. Richard Shaw, professor of psychiatry and pediatrics at Stanford University School of Medicine, and Dr. Sarah Horowitz, who is the professor of the Department of Child and Adolescent Psychiatry at NYU Grossman School of Medicine in New York, document the magnitude of the psychological reactions of parents of premature infants, both mothers and fathers in the NICU. Drawing on the work of Margaret Stuber and Ann Katz in the field of pediatric oncology, they expanded their views of medical PTSD as incorporating the frequent and repetitive traumatic medical experiences encountered by parents in the NICU, often on a daily basis. They explain that the use of the term continuous traumatic stress disorder perhaps best encapsulates their conception of the parental NICU experience. Continuous traumatic stress disorder. Research shows that parent engagement in infant clinical care improves parent mental health outcomes, including symptoms of anxiety and depression. And parent-driven interventions also have a positive impact on both infant and parent outcomes. Infants who experience early skin-to-skin contact experience less pain, have improved neurological developmental outcomes and growth, and they experience less psychological instability. Existing data suggests that parents who participate in clinical care feel more confident, bonded with their infant, and prepared for life at home. I asked Dr. Sue Hall, a retired neonatologist with a master's in social work who is a leading champion for family-centered care, her thoughts on the impact of stringent parent visitation restrictions that have been imposed because of COVID-19. She remarked on just how much the landscape of the NICU has changed over the last 30 years when she first began practicing. Then she said little was known about the importance of developmental care to the outcome of the baby, and the healthcare providers failed to recognize and emphasize that parents were the most crucial members of their baby's development. Now that evidence has firmly shown the benefits of parental involvement to babies' developmental outcomes, she said it is absolutely imperative that we not let the COVID-19 pandemic turn back the wheels of time by limiting parents' presence in the NICU. She stressed that parents are essential workers and need to have virtually unrestricted access to their babies in a way that best ensures everyone's safety from the virus. Christina Coy is no stranger to the NICU. Her first son, Grant, spent weeks in the NICU in 2017. But when she gave birth by emergency C-section to her son, Owen, in May of 2020 in Dallas, Texas, the world and the NICU were drastically different. First, her husband had to attend her C-section by FaceTime because of hospital visitation restrictions. Christina was still in recovery when the neonatologist came to tell her that Owen needed to be transferred to another hospital for surgery. She was all alone with no one for support. Not surprisingly, she had a panic attack and she struggled to breathe. The hospital allowed her husband to come in briefly to comfort her. She begged to be released so she could be with her baby. She was released, but without pain medication, and she could not access a pharmacy because of protests in the area that had forced store closures. She said it felt like she was living in a war zone. Said there was just no words to truly describe how awful the experience truly was, like living in an unending nightmare and constant state of shock. Christina said she never cried so much in her life. She felt the NICU should have and could have done more to connect her to local and national support resources. She has since connected with Hand to Hold and attends weekly virtual support groups and has been matched with a peer mentor. Let's talk about peer mentorship. Peer support is one of the 6 principles of trauma-informed care and has been shown to help mitigate mental health challenges experienced by parents. While many NICUs recognize the heightened risk of perinatal mood disorders and understand the value of family-centered, trauma-informed care to help parents process a traumatic birth experience in NICU stay, only a small percentage allocate budget her psychologist or therapist. Most social workers carry large caseloads and must focus their efforts on those with the most extensive needs. COVID made these resources even harder to access due to parent limited time in the NICU. And hospitals that were lucky enough to have peer support programs in place pre-COVID were forced to disband them because most were not considered essential workers. It created the perfect storm, leaving NICU parents flapping in the wind. Peer support is one way to enhance feelings of safety, trust, and collaboration. Individuals who have lived through challenging experiences and who have been trained to provide peer support can help parents cope with and recover from their experience. The concept of peer support takes on added importance during the pandemic because requirements for isolation, quarantining, and social distancing can lead to diminished interactions between parents and their support systems. Part of the healing process that often gets overlooked is connection, compassion, and genuine concern. Every NICU parent should be referred to a peer-to-peer support program, support groups, virtual support groups, and counseling when needed. Kira Sorrells is the NICU parent, and she is the founder and executive director of the NICU Parent Network, a collaborative NICU support organization across the country. And she believes, and the NICU Parent Network believes, that peer support has never been more needed. Kira believes peer support is the only ray of hope many parents have to find their way through the NICU journey. In 2010, I founded Hand to Hold to provide support to NICU parents that I so desperately craved during my son's long NICU stay. Our mission is to provide personalized support before, during, and after a NICU stay to help ensure all NICU families thrive. Hand to Hold has revolutionized the delivery of psychosocial support for parents following a traumatic birth and has quickly grown into a leading national support organization for NICU and bereaved parents, transforming the way families access critical information, resources, and support during and after a NICU stay or loss of a baby. Programs are offered in English and Spanish, including in-hospital family support programs led by trained family support specialists, a national peer mentor network, support groups, online communities, 5 podcast channels, and a telehealth counseling program. Hand to Hold is committed to fostering safe and caring healing spaces for families. We cultivate a community of empathy and honor each unique journey and prioritize peer support. We recognize the heartache, grief, and trauma NICU families experience and meet them where they are with grace and acceptance. We are committed to fairness and impartiality in everything we do. We know we must be well-informed and inclusive of all perspectives to meet diverse needs with accessible, comprehensive support. We're trustworthy, honest, reliable, authentic, and accountable. And we're thought leaders and change makers. And finally, we are always learning and developing innovative programs and evolving our strategies to champion a world where all NICU families thrive. Hand to Hold has trained hundreds of NICU graduate parents to provide support to new families. Requests for a peer mentor more than doubled in 2020. In response, we launched virtual support groups utilizing our proprietary curriculum. Daily online groups are led by Hand to Hold peer support certified family support specialists. We host groups for both current NICU parents as well as NICU graduate parents and bereaved parents. We also offer groups in Spanish In response to direct requests, we also offer a group for Black moms to ensure cultural sensitivity and that they feel safe and understood in a group of their peers. Hand to Hold also hosts 5 podcast channels, including channels for NICU parents, NICU graduate parents, NICU dads, bereaved families, and NICU professionals. NICU professionals can earn free continuing education for most episodes. Drawing on the huge success of our national virtual support group, we are launching the first virtual private platform in May, inviting NICU parents and professionals to join us in our own private virtual community. Our NICU community provides the convenience of a mobile app and the social aspects of Facebook, in addition to our robust online resource library and the opportunity to connect virtually with our staff of trained family support specialists. We were very lucky that Hand to Hold's family support specialists were only considered non-essential during the first weeks of COVID and were able to return to round in the partner hospitals, meeting with parents to provide comfort and support in the absence of their spouse, partners, and extended family. Sarah Flock, mom to Evan Cinto, born at 25 weeks gestation in April 2020, said the absence of Hand to Hold family support specialists made an already unbearable situation even more unbearable. Sarah told me that being in the NICU alone was very difficult. She found it hard to process all the information alone and often had a hard time reporting back to her husband all that the doctors and nurses had relayed. One such incident led her husband to being misinformed for weeks about the results of their baby's ultrasound. She said it was like playing the worst game of telephone, and she and her husband switched off care each day. She could not decide which was harder, being alone in the NICU and experiencing the challenges firsthand with the onus of having to be the bearer of bad news when her baby had a setback, or being the parent not in the NICU and worrying constantly about the baby. She said it was just burden upon burden, and she and her husband were fraught with anxiety throughout their baby's 112-day stay in the NICU. Evan Cinto is home now and 6 months adjusted. His long-term prognosis is good, and they are grateful for the support they receive from Hand to Hold during their NICU stay and report that our resources continue to make a difference in their lives. A new consensus statement that parents and guardians are essential caregivers and should be allowed at the bedside without restriction, especially if they live in the same house, has come out recently in response to these visitation restrictions. The statement is based on the responses from parents interviewed for a University of Michigan-led research study of a neonatal intensive care units from 36 different hospitals throughout the country throughout COVID-19. Lead author Ashley Vance, research fellow at the University of Michigan School of Nursing, said limiting family presence has unintended consequences. Parents reported feeling increasingly isolated, stressed, overwhelmed, and anxious without a support person. They were concerned that decision-making was not as effective and communication was unclear as one parent must communicate information to the other. If only one parent or caregiver can be present, the other misses out on opportunities to gauge and care, which is especially important in cases requiring complex care or additional education prior to discharge. The family is also split when the goal of care is often to facilitate parent-infant relationship to support rest, growth, and health. Vance believes parents provide essential care and are allies in care with providers. And the statement advocates for families to be respected as essential members of the care team during hospitalization. Parental presence can be encouraged by prioritizing policies that affirm their presence in caregiving by inviting their participation in the revision of these policies. and by setting clear expectations for what presence related to COVID-19 means. The National Perinatal Association and the NICU Parent Network have made similar statements, advocating to exhaust all efforts to ensure parents are encouraged and supported to be fully integrated into their baby's care. Sharon Posen, mother to Emery, born at 24 weeks in January 2020, said the lack of connection and isolation during her daughter's NICU stay was unbearable. She felt the NICU nurses were distant, but they had to be because of social distancing policies. And although her daughter is home and doing well, she still has not met another child. And Sharon worries that what this will mean for her daughter's long-term emotional and social development. And like most of us on this call today, she said it is going to take her a long time to process 2020 and all that she and her family missed out on. And as hard as the past year has been for me, and I'm sure for all of you, I think we can agree that NICU families did indeed miss out on a lot. Storms are opportunities for growth, revelation, and miracles. I have this quote written on a bright orange sticky note on my desk. I wrote it down sometime early in the pandemic. I don't know if I heard it in a sermon, on a podcast, I just really don't remember where it came from. But it's been this constant reminder throughout 2020 to look for opportunities in the midst of the chaos and the challenges and the fear. And I think we have this opportunity right now to look at the negative impact of restricting parent visitation in the NICU over the past year, to support sweeping adoption of standardized requirements for family support, trauma-informed care services embedded in every NICU, not only during COVID, but all year through from here on in. We must recognize the importance of peer support and counseling for NICU families. Given all that we know about the short and long-term impact of traumatic birth and a NICU stay on a baby and their family, it is negligent to leave NICU parents flapping in the wind to find appropriate resources on their own. The NICU stay is only the beginning of the journey, and NICU parents need ongoing support to ensure their baby and their family thrives. COVID-19 will likely be a part of life in the United States for the foreseeable future. To ensure the best outcomes of babies and their families, I agree with Dr. Walker. We need a COVID task force made up of neonatal healthcare providers, infectious disease experts, and families who could work with hospitals around the country to provide national guidance and education. Hand to Hold and the NICU Parent Network hope to be a part of this discussion to ensure that the voice of the parent is represented. My son spent 4 long and difficult months. His first years were full of doctor's appointments, surgeries, medications, and occupational, speech, and physical therapy. I walked those years in a constant state of anxiety and paranoia, depression, and denial. And sadly, I walked alone. But today's NICU families don't have to. Please join me as we shine a light on the impact of traumatic birth to ensure every NICU parent has a hand to hold. I invite you today to visit handtohold.org to learn more about Hand to Hold's free resources. You can order free rack cards for your hospital for free. We just ask you to pay for shipping. If you'd like to learn more about bringing a peer support certified family specialist to your hospital, call me or email me. Let's talk about it. If you and your NICU are interested in continuing education to help improve support of NICU families in your care, I encourage you to visit myperinatalnetwork.org to learn about their free online trauma-informed care trainings. And I invite you to please mark your calendars for November 3rd through 5th for Hand to Hold's first virtual conference for NICU parents and professionals. There's no cost to attend. We are thrilled to welcome keynote speaker Susan David. She's an award-winning Harvard psychologist and the author of the #1 Wall Street Journal best-selling book, Emotional Agility. For NICU professionals, the conference will feature leading experts on trauma-informed care, palliative and bereavement care, and compassion fatigue, and CEUs are available for free. NICU Parent Tracks will feature sessions on breastfeeding, fortification, nutrition for NICU graduates, meeting milestones, and overcoming trauma. Hand to Hold's NICU Community Conference is the only conference exclusively focused on the care, support, and improved communication with NICU families. You don't want to miss it. Visit Hand to Hold /NICU Community Conference to join our pre-registration mailing list now. On behalf of NICU families, thank you so much for joining me today, for us to just pause and think about the restriction policies over the past years and for COVID, and just the long-term potential negative impact on babies and their families. What can we learn from this past year so that we can do better in the future to ensure all NICU families and their babies thrive? Thank you so much. At this time, I will open it up for any questions that you may have.
Thank you so much for that information, Kelly. You have such a powerful story. You can just hear the passion that you have for this subject in your voice. And you took something that was negative in the beginning, having your child born in the NICU, and you turned it into something positive to help others. And I think that's great. And I applaud you for that. We do have some time for some questions. If you want to submit those into the chat function, we'll try to get to those. The first one is, what was the name of the organization, the National Perinatal blank, with training for professionals?
Right, so that is the National Perinatal Association. And you can visit it if you Google National Perinatal Association or myperinatalnetwork.org. And there's free trainings for NICUs on trauma-informed care, but lots and lots of resources there. And they have produced a lot of this education in conjunction with a NICU parent network. And so we are so proud to be that parent voice working in collaboration with NICU professionals to provide this training on trauma-informed care in the NICU. And there's some specific trainings around COVID and supporting parents through traumatic birth. So I really encourage you to check that out.
Thank you. Someone was just commenting and saying thank you for providing diverse resources for NICU families. So thank you for that. We did.
Yes, I think it's so important that we talk about that and be aware of kind of when you look at the birth statistics and where we're going in the United States, we know that more women of color experience premature birth, right? And so if we know that, and we know that they have a higher incidence of perinatal mood disorders, we need to be ready to provide them not only cultural sensitive support, but also that there not be language barriers. I find that that is just tremendously difficult in a NICU stay, and just prohibits them from getting the care and the services and the resources that they need when there's a language barrier or a cultural barrier. So we really are dedicated, because we know that we are just going to see more and more of those families in the coming years, as we are predicting a lot more births to Hispanic speaking families and Black moms. So we know we need to do better.
Okay, the next question is there a certificate that RNs may earn as a trauma nurse in the NICU?
There are, and I think it's really important for you to maybe do some research around trauma-informed care. I know Mary Coughlin has a wonderful training, a really intensive training on becoming a trauma-informed care advocate. Again, her name is Mary Coughlin. And Kira, I don't know if you're still on, Kira from the NICU Parent Network, if you might help me out. I don't know if there's a chat or a way for you to put that in. A link to her care, but I'm happy to follow up with you to Kim to provide that to our participants today. But Mary Coughlin has that, and the NICU Parent Network, and to be more as a certified trauma-informed care specialist. Yes.
We can certainly, if you want to email that information to me, I can certainly provide that to everyone after the webinar in an email.
I'm sorry,
so I'd be happy to do.
I'm totally blanking on it right now. Kira, if you might want to text that to me if you're still on, and I can let them know, but I think it's Caring Essentials, if I'm correct. Caring Essentials with Mary Coughlin is a great one, but then again, my perinatal network. Yes, Caring Essentials. That's right. Okay, next question, if we have any more.
Sure, the next question is, how do you incorporate pumping / access to human milk for NICU parents in your training for peers?
Will you say that one more time? How do I incorporate pumping?
How do you incorporate pumping and access for human milk for NICU parents in your training for peers?
That's a great question. And I think it's really important for us to point out that our peers are meant to be emotional support, not giving medical information. If they are asked about, we talk a lot about how difficult it is to pump in the NICU, and we provide a lot of encouragement around, we know it's difficult and we know it's best for our baby, and how can I support you in being able to do that longer? And being an advocate for your baby. So maybe like me in my NICU, there wasn't a great place for me to go and pump at the time. I think we've come a long way in the last 20 years of making a lot of improvements on pumping at the bedside and better access to support services for pumping breast milk, and so that those babies that need it get that human milk at the beginning. But I think as far as our peer mentors, there is some information in there about that breast milk is best, and we want human milk, and we want to support moms around breastfeeding. But I think it's really important that you understand that our peer mentors are there to give emotional support. They're not giving clinical information. They're not advising on what you should do. They're helping you learn to find your voice, to advocate for your baby and ask the questions that you might need to ask. So maybe it's asking your lactation support specialist for more support, or telling your nurse that you're not comfortable pumping milk and how, or you don't have access to a pump, and what do you need, and helping them find their voice. So those are some of the things that we would do to make sure that moms are making those decisions to pump. But I will tell you, not every mom is able to provide breast milk. And so we are there to provide the support we can for them to make the best decisions they can for their baby. So if they're not going to provide breast milk, it's asking those questions about donor milk and what's available for their baby to make the right nutrition decisions for their baby. And being involved in that decision making, I think, is so important.
Right, and to kind of speak towards the human milk for babies that are in the NICU during this COVID pandemic, our webinar that we had last Thursday on the 11th was research done by antibodies against the COVID-19 virus in breast milk. And that's available if anyone wants to access the recording of that. That's available on our website, and I can provide the link to that webinar. But it does show how important it is to moms to continue to provide breast milk to their babies during this pandemic.
And I think we have seen that those that have a peer mentor tend to pump longer and do a better job breastfeeding and pumping, because it is very difficult and draining, and on top of everything else that you're going through as a parent. But to understand how pumping that milk and the bonding process and providing that breast milk long term, and even that our parents can breastfeed. Even, my micro preemie, it took many, many months after hospital discharge, but he did finally breastfeed. So just giving that level of support and encouragement to from our peer mentors to our families is so important.
And speaking also, someone asked a question about how your son is doing now.
Oh, that's so sweet. I always forget to come back, and I often have parents or professionals chase me down after I speak at a conference to ask me. So thank you for asking. I'm actually here in Tennessee today. I'm coming to you instead of from Texas. I'm in Tennessee to visit him. He is actually in his sophomore year at Belmont University in Nashville, Tennessee. I think if you didn't know his story, you wouldn't know that he was born preterm. But we invested heavily in we did occupational speech and physical therapies, vision therapies, lots and lots of gross motor, fine motor, just so many therapies early on. My husband, I remember still very vividly that he asked me, he was like, why are we saving for college if he can't go to kindergarten? Like, let's just invest everything we have right now. And so I find that those first 5 years to me are just so vital and so important that we invest in these babies. And, their challenges go for many, many years after the NICU stay. And I think that's why hand to hold is not just for during the NICU, but once they go home. I think there's the misnomer that at the age of 3, they're adjusted, right? Everything at the age of 3 is supposed to be, there's this fairy dust that happens when they turn 3 and everything's fine. I think that's really bad information to give to NICU families. I think that many of us face challenges for a lifetime, a lot of learning challenges. My son, I think he'd be okay with me telling you, but he still struggles fine motor wise, using scissors and some other things, but he overcompensates for it in other areas and is just doing wonderfully. Health wise, by the age of 5, 6, we weren't seeing as many issues. There were a lot of upper respiratory and some things with feeding and nutrition early on, and we see that a lot through hand to hold. It's a lot around nutrition, vision, learning delays, ADHD, some things like around OCD. We're seeing a lot of tendencies toward. So we just want parents to have as much support and education well beyond the NICU, because when they leave those hospital doors at discharge, they're really just starting, they're starting this journey, but now they don't have the comfort and care of our amazing care team within the NICU. And oftentimes, unfortunately, we're also educating our pediatricians, because most pediatricians, they may have a couple of NICU grads, but they're not, well trained in meeting the needs of a micro preemie. And as we see more and more babies surviving even earlier, right? So now I was just reading something about a 22 plus weeker last week. What are the long-term challenges these babies are going to face, and how are we better equipped and able to educate these families and make sure they have every information, all the information and resources they need so their baby can thrive. And, how do we work with our educators to better know how to work with our children and find their strengths and work to those strengths and not hold them back because of those learning delays because of being micro preemie. But it's so different for every NICU grad. We just see so many different outcomes. Another baby that was born after Jackson at 24 weeks, 1.5 pounds, similar story, but has had totally different outcomes. So I just think we just don't ever know what that journey is going to look like for a baby and their family.
Okay, there is another question. The next question is, do you find it difficult to engage families of color in the NICU?
I think it would be a misconception to just lump them all together. I think it's like any other family. I think it's, are they coming from a place of having a previous loss or trauma? What are they being met with when they come into the NICU? Do you make them feel welcome? I think that there's a lot of misunderstanding, I think, with NICU professionals of why are parents not there and not engaging? And I think we tend to judge, and even I'm guilty of judging, when you see you know, back before COVID, like, why do you not see a parent at that baby's bedside for days on end? And so I think that, you know, you got to look at all the challenges. You know, maybe they have other children at home. Maybe they work shift work, and if they miss a day, they're going to lose their job. Maybe, like me, they had to go back to work to keep insurance, right? And so I wasn't at my son's bedside. After 6 weeks, I had to go back to work to keep my insurance. So have they had a previous loss, which is, you know, like this is bringing up trauma and grief. And I tell you, like, not all NICUs are the same. I have met amazing, amazing NICU nurses from across the country, but not all are trauma informed. Not all make us feel welcome in the NICU. Not all neonatologists have the best bedside manner. Um, and so, you know, maybe they've missed a week because of shift change, or a baby at home, another child at home that's sick, or because they can't quite, like, frankly, afford parking. You know, I know in Chicago, some of the hospitals, like in the parking around there, like we know families that are just, you know, so many challenges that will keep them from being there. So I don't think it's just Black families. I don't think it's just families that have a language barrier. I think that we all want to be with our babies, but what are these tremendous barriers that we have to overcome to be there? I mean, I didn't want to be there in the beginning. I mean, my husband and my mother really coaxed me into the NICU. I felt a lot of guilt about that. Like, why do I want to be at my son's bedside? Why am I not, like, just wanting to engage and fight for him and advocate for him? But it's, you know, there's a form of grief where I was so scared to bond with him and love him because I was so scared of losing him, right? And so I think we just have to look at, what are they going through? What can we do to make them feel welcome? How can we help them overcome those barriers and get the support that they need so they can be there? Because every parent loves their baby. Every NICU parent loves their baby. So how can we make sure that they're there and interacting, and what's our role in kicking down those barriers so that they are there?
I think that was very well said. If everyone looked at other people like that, I think it would be a better place. We're almost at the top of the hour, and I think we could go on for another hour. This is just a great topic and great information that you're delivering. I wanted to mention a couple things before we do end for today. Again, reminding everyone that certificates will be available on Friday by downloading those off of your account. We will go ahead and send an email probably the beginning of next week with the items that we spoke about providing at the end of the webinar. And our registration will be open soon for the April 8th and April 21st webinars. And when I sent out the link and the handouts for today's webinar, I also provided a link to our brand new Paula Meyer video series that we have just launched, as well as a white paper that was recently published regarding COVID. So if you want to go back to the email that was sent out earlier today to get those resources. Also feel free to email us at education@medela.com if you have any questions. But thank you so much, Kelly, for presenting this great topic and providing these resources. And I hope everyone has a great afternoon. Thank you.
Thank you.